Hey guys, Carrie Gardner here with Synergistic Effects. Today's workout is going to be core activation workout for spine health. So what I'm looking at doing is teaching you guys about the spine and how to maintain a healthy lumbar and thoracic spine. So the first thing I want to do is just to talk briefly about the degrees of freedom or the planes of movement that the spine has. We have, if you cut the body into right and left halves, this plane of motion that cuts straight through our body is called the sagittal plane. And our spine does flexion and extension in that plane of motion. The second degree of freedom that we have would be cutting our bodies into front and back halves, okay? That's called the frontal plane. And we have lateral spine flexion in that plane of motion. So we're moving parallel with that plane. The third degree of freedom that we have is rotation. So spine rotation, of course, twisting. Okay, it's when we cut the body into top and bottom halves, and so we're moving in parallel with that plane that cuts through here. So that being said, that's what you want to think about while we're doing low back exercises. So we're going to start with some warm-ups first, and then we're going to move into doing like plane specific motions, and then we're going to start doing combinations of those different planes. So multi-planar motion and anti-rotation exercises. So first up today, we're going to have knee up. We're going to crisscross across our body here. Okay, so using our contralateral arm, we're going to press the thigh into that, and then we're going to rotate. So knee comes up, we're pressing and rotating. So I don't want to pull the leg across our body this way. I want that leg to resist as we're doing the spine rotation. So we're going to get in, 20 rotations here about. So this is 5. This one is excellent because we're actually engaging our internal obliques in our lower abdomen and our hip flexors to lift the knee up. So this is great blood flow increase to our core. We're getting our rotation going here in our spine. And you can feel how we're just really starting to get things moving along here. Okay, we're just going to do a few more. And this is also working that single leg posture, right? We're standing on a single leg, my pelvic floor is engaged, my abs are being pulled back so that I have good balance. One more here. Great. Now our next one, we're going to do what's called a side step. I do a crossover and then add spine flexion to it. So I'm crossing the side of my body that I'm crossing forward. I'm also going to do a side bend in that direction. So now we're working in that frontal plane of motion, and we are opening up the side of our rib cage. We're opening up our IT band down here below. We're getting those lateral facet joints, the transverse facet joints in our spine to open up. And so we're just going to keep taking that step and crossing over. Again, warming up this frontal plane of motion. Great. We're going to do a few more here. So spine health is so important, whether we're having active discomfort in our back or whether or not like we've suffered from it in the past or that we just want to prevent it from happening. So an ounce of prevention can be worth millions in the future. Here we go, one more here, and we're reaching over. Great. Okay, so the next exercise that we're going to do standing posterior pelvic tilts. So what I'm doing for that one here, I'm pulling up my pelvic floor, my abs are tight, and then I'm engaging my glutes while I scoop my tailbone under, and I'm going to hold this really tight here, and then I'm going to relax. So I'm doing a posterior tilt here. So I'll turn from the side. You can see I'm going to tuck my tail forward. So now I'm working in that splitting my body into right and left halves. I am working in that sagittal plane of motion. So we're opening and closing the joints in our spinous processes. So when we tuck under, we're pulling those spinous processes farther apart in our lumbar spine, and then we're going back to the neutral resting state. So we're going to do a few more of those here. So you can feel I'm really tight in my lumbar spine, so I can really feel this starting to open up and make things get the blood flowing, and it's so much better just doing this motion. I'll actually stand in the morning at like the bathroom sink, and I'll press up on the sink and allow my lower body to hang in traction and then do a pelvic tilt so that I can have traction in combination with the pelvic tilt to really activate the internal obliques here in my core and the transverse abdominis. So the next thing that we're gonna do, and we only need a couple of things for this exercise routine today. We just need a stability ball, a mat, and some TheraBands. And the ball doesn't even necessarily have to be used. You can sit on a chair if you didn't have a ball, that would be fine. But if you have a ball, it's great because it gives you a little bit more motion and range. So I'm gonna grab my tall ball here. So we just did standing pelvic tilts. We're gonna also do them seated on the ball here, okay? So when we're scooping our pelvis forward, and you can get more range of motion in the seated position, I want your abs engaged really tight. I want the pelvic floor engaged. I want your transverse abdominis engaged. So that's between your pubic bone and your belly button. So we're dragging all of that in. And I want you to squeeze your glutes too. And then we're gonna relax everything. So again, pelvic floor is engaged, abs back, glute activation. We're gonna squeeze, 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 and then we're going to relax. So again, keep firing pelvic floor, abs back, glutes, and relax. Pelvic floor, transverse abdominis, glutes, and relax. So we're gonna keep going in that pattern, and it's really important. And then glutes, and then the tilt, and relax. It's super important for you to fire the pelvic floor first. That has to be fired for you to be able to open up or to engage your transverse abdominis. So this is a neuromuscular re-education pattern that we do with back patients, trying to help their body to learn to stabilize, because you first have to fire the floor of your pelvis in order to get the next sequential firing to occur. So as we keep going through these, we're going to do a few more here. And rest. So now I want us to see if we can move our pelvis through circumduction. So that means to draw a circle. So I'm going to reach forward here with this hip, and then I'm going to draw a circle back around, and now I'm engaging my abs on this side, and now I'm forward, so it's both abs, and then it's over here to this side, and then I'm relaxing on the back side. So again, it's engaging my hip on this side, centered down my abs, the other side, and back. So really thinking about what am I doing, what am I engaging to get my body to move in that circular pattern. We're really trying to activate the core properly as we go across. And we're gonna do 10 to this direction. So I'm going clockwise right now, and then we're gonna turn and go counterclockwise. So again, it's pelvic floor engagement, your transverse abdomen, we're getting your internal obliques on each side. And give me a couple more here. And these can be very, almost kind of like painful when you have low back, like a lot of low back tension. But it's important that you differentiate between, do I feel nerve pain that's traveling down my spine, or am I feeling just tightness being opened up? Tightness being opened up is always okay. But if it's something that you feel is a hot pain, a shooting pain, a traveling pain, that's something that you would always want to back off. And the first thing I ask people to do, we're going to start while we're talking here, we're going to go down the counterclockwise direction. But what I ask people is, can you find a range of motion that is comfortable where you're completely asymptomatic? And that's always something that's important. Anytime you're working in an exercise, you want to find an asymptomatic, pain-free range of motion. And especially when you're working with the back, because you really have to get things moving. You have to increase that circulation to get the viscosity out. So viscosity is when you have a thickening of the joint fluid. So it gets almost gelatinous in nature. Once you start increasing circulation, it liquefies, and then there's a lot less pressure. So with things with arthritis, a lot of times it's that increased viscosity from lack of movement. And if we start moving the body through its range of motion, we increase circulation, and then we get that nice cellular exchange of the fluids, and we can get things more free moving and really decrease the patient's pain. So we've done pelvic circumductions in the clockwise motion. We've gone counterclockwise. Now I'm going to have us go back into those pelvic tilts again. So we're going to repeat what we just did with these two exercises, the pelvic tilts and the pelvic circumduction. And I know that these are definitely, they're really small movements, okay? So that's why we said core activation for spine health today, because we want to work on these small intrinsic muscles that need to be working and doing their job so that we're activating and stabilizing our spine. And I can tell you right now, with how stiff I was before I started shooting this video, my back already here into the second set, I'm feeling significantly better just from the increase in circulation and moving my body through these specific ranges of motion. So again, we're going to do another 2 here of these pelvic tilts forward, tight, tight, tight. Your glutes are tight, abs are tight. we're relaxing, and one more here, and rest. Good. So now clockwise circumduction. Remember, abs are tight and engaged when you're in the front half of your semicircle, and then you relax through the back half of your semicircle. So we're gonna do tight, tight, tight around here, and then the second hemisphere relaxed, and squeezing those glutes too while you're forward, and then relaxing. So try to think about, as you're coming over here to this hip, the opposite hips engaging, and now both hips are engaged. Now I'm relaxing this side, now both are relaxed, okay? So it's a lot of like cross pattern activation that you're trying to think about while you're doing it. So again, flexing the side that you're traveling towards first, going through the middle, back, and then rest here to the center. Okay, so now drawing in the counterclockwise motion. Again, we're activating the first hip that comes forward, now straight down the middle, now the other internal oblique, and relax on the back side, and getting those glutes to be firing properly too. So this is just some little nitty-gritty stuff, but if you're really concentrating on having some fine motor control and activation through these patterns, you can find it to be extremely helpful for your spine health. All right, we'll do 3 more here this way. Remember, we're getting tight, tight, tight. Everything's engaged, and then relax on the back side. Everything's engaged here through the front, relaxing, and one more time, engaged, 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 and relax. Great. So we just worked in the sagittal plane, doing like our just straight pelvic tilts forward and back. Then I did some cross plane work where we were working on the circumduction with the pelvic tilts at the same time, okay? So now I'm gonna do just transverse plane spine rotation. I have a band that is attached to my, my pole here. So I'm gonna pull it up to about waist height when I sit down on the exercise ball, okay? So I will show you this side facing forward what it looks like. Notice that my handle is straight down right in front of my belly button. I want to bring my elbows in as tight as I can. This is not going to be an arm motion. This is a spine rotation. So right now I'm doing anti-rotation because my body wants to actually turn back towards the post this way. Okay, so I'm isometrically engaged here. I'm going to turn away and then come back to neutral center so that my spine rotators are loaded the entire time. I feel this in my internal obliques and my external obliques in my abdomen, and I can feel it deep into my rotators, deep into the quadratus lumborum, to the multifidus, which is all these really deep low back muscles that I have. So we're gonna sit here and you can really feel it. I want you to sit tall. Think about rotating your vertebra around that vertebral column. And you wanna have spine neutral. So the way that I'm sitting on the ball here, I do not have my pelvis tilted either direction. I'm just sitting like as if I were standing up. And relax. Okay, now I'm gonna sit from the back. I'm gonna turn around to do the other side so you guys can see what it looks like here. So you can see I'm rotating over my shoulder. And if you look in the direction that you're traveling to, that can be very helpful. Great. So we're about 4 repetitions in here. 6. Great job. 7. 8. 9. And these are pretty challenging depending on how much your resistance band is. 13. 14. Here we'll do one more. 15. Great. So now we're going to repeat these, okay? So we're going straight into them. So I'm going to have you go back into the seated spine rotation. This is one of my favorite exercises for my back. It feels so good to have that resisted spine rotation, and then for you to stop and have an isometric engagement before you turn the other direction. Really remember to keep that handle grip like right in front of the center of your torso. And again, looking over the shoulder that you're rotating towards is very helpful for that proper engagement. Sitting nice and tall. Couple more here. 14 and 15. Great. So I'm going to turn away from you. So we're going to fire up the other side. Again, seated spine rotation. So you can see that I'm really trying to keep my pelvis level. I don't have any motion in my hips. This is all in my low back and in my thoracic spine. 6. And nice, concise, clean movements are always important. You don't want to rush anything too fast. The more you control it, especially when you're returning back to center, that eccentric load, the more you're going to get out of it from the loading pattern. We'll do a few more here. 14, I think, and one more here, 15. Awesome. Okay, so we have now done our flexion extension with the pelvic tilts. We've done rotation, so now it's time to add in some lateral movement, some lateral spine flexion. All right, so for your lateral spine flexion, what I want you to do is I want you to find a wall or a post that you have in your house. So you're going to put the hand closest to the wall up on the pole, then you want the leg closest to the wall, crossed over in front. Now I'm going to be pushing my hip and hinging it towards the wall, okay? So this right here is giving us that lateral spine flexion. You don't want to see any rotation occurring like this within your torso. We really want it to be clean lateral flexion. And you're just going through, again, what's a pain-free range of motion for you. This one's usually pretty tight and locked up with people. I find that getting the transverse facet joints to open up and to unlock and to start having better fluid motion and quality motion is a lot of times the key to unlocking a lot of discomfort for people in their spines. So a lot of times in the shower in the morning, I'll lean against the wall and I'll do probably a set of 15 each side at least, just to help really loosen things up. It helps a lot. Hot moisture heat, it gets deeper into your tissue than a dry heat does. So, you know, take advantage of being in a shower environment, or if you're sitting in your bathtub soaking and doing some of the spine work after that, it can be extremely helpful for you. So now we're going to turn around the other side, and I can face you guys still and kind of talk here. We'll see from the side how you can see I'm moving in this plane of motion where I'm not doing any kind of a rotation. So again, the leg closest to the wall is crossed over in front. This also is somewhat of an IT band stretch you can feel. Depending on how tight the patient is, they'll really feel the IT band open up as well. And all these attachments here on the side of their torso. So again, this being that third degree of motion for the spine, being the lateral flexors that we're working through. One more here, and 15. Great. So I'll face you guys again. Foot closest to the wall. We're going to cross over and begin. If you're pretty stiff on that first set, you can find that the second set will feel a lot better. So pushing through and kind of seeing, you know, instead of stopping when you feel things are really stiff, but kind of pushing through stiffness, as long as it's not pain and it's just stiffness, you can find a lot of success by carefully navigating through range of motion. A couple more here, 14 and 15. So you can see that these are all pretty light exercises. The spine rotation's been the most difficult so far that we've done because I was using a thicker band, but you can also do that with like a really light band so that it's just a small amount of resistance, which can make it be a, you know, obviously an easier exercise. We're going to do just a couple more here, then we're going to move into a little bit more advanced stuff. Do some mat work. One more here, and 15. Great. So I don't know about you, but I am definitely feeling so much more open and warmed up in my lumbar spine. So now we're going to start to pair together. We're going to get down and do some mat work. We're going to go quad ped, and it's going to really start to engage like our hips as well as our shoulders. So let me get us set up there, and we'll get started. Hey guys, so now that we're down on our mat, we're going to get into a quad ped position. That's when you're on all fours. So I'm going to come down here into this this position here with both hands. I want shoulder blades to be rolled down and back, and I want our abs nice and tight so that they're engaged. Next, you're going to lift one arm up, okay? And you're going to reach towards that wrist and then open back up again. So I don't want to see the pelvis tipping. If you can hold it as still as possible, that's what we're looking for here. So this is combining our core stabilizers within our anterior trunk, so our abdomen, And we're activating our spine rotators, so they're working synergistically with each other. And this actually is a lot more of a pec activation exercise too, because you can really feel it being single-armed here. So really we're in kind of a tripod position once we get started on this exercise. And one more here is 15. Now we're going to switch sides. So that hand is directly under the shoulder. We're bringing our other arm up, and now we're reaching down to that wrist and opening. Good. Trying to keep that pelvis to be nice and level. You got 3. And really feel the rotators of your spine here. 4. Good. 5. 6. 7. Now we're going to do something a little different when we switch sides again. We'll change our hand position. You can really vary where your hands are within this exercise, and it can change where you're feeling the rotators fire. And one more here, 15. Now, instead of our hands directly under our shoulder, I'm going to move the stabilizing arm under my other shoulder, okay? So I'm putting in a little bit of a diagonal pattern here. So now I'm opening up, and that changes where I'm feeling it across my back. I actually feel it closer to the middle of my spine than towards the outside. We're going to go 15 here. And I really feel it along the rim of my ilium, my pelvis, the wings of my pelvis, and all the rotator attachments there. I ran outdoors a couple days ago, first time in a while, because it's been snowy here, and getting on the trails and the different undulating pitches from running trails can really change how my back feels. And 15. So this stuff is amazing to get me going again and to really loosen things up. All right, so we're going back to the other side. So again, we have that diagonal pattern. So we're trying to work as many different fiber insertion points as we can by changing that hand position. And you don't have to go all the way across to the full other side. It can be somewhere in the middle. It can deviate even less than that. And if you're just comfortable keeping it in the original position, then that's absolutely fine too. I'm just giving my body variety, because I think variety is really helpful to work as much as we can. One more here. Good, and 15. So now what I like to do after getting these going, I like to take a moment to stretch the lumbar spine and the rotators there. So I'm going to put us into child's pose here. Your hands are going to slide forward, and then you're trying to have your bottom down on your heels. So here we're at neutral. Taking nice deep breaths in, and a long exhale, sinking deeper into it as you exhale. One more breath in, and exhale. Now as we take the breath in, I want you to exhale the arm into this thread the needle position. So I just threaded my right arm under my left armpit. And now we're going to switch sides here, and we're going to rotate that in. Good. Okay, and then carefully walk up out of that. Next exercise that I'd like us to do, I'm going to turn the mat here to the side so that you'll be able to see. We'll go into like a diagonal position here. I think that this should be a pretty good view for you guys. I'm going to put us on our back, so we're going supine. I'm going to have us take our lower body, okay, and we're going to rotate our lower body. So this is the starting position here, okay? Now that we're in this lower body spine rotation, I want us to do pelvic tilts while we're here in this position. So now I am scooping my tailbone up and forward, just like when we were sitting on the stability ball before, and I'm relaxing it back. So you're combining rotation in a different, with gravity working through our bodies obviously differently, because now we're in that prone position laying on our back. But you can feel it when you engage and do the pelvic tilt here and engage your transverse abdominis, it opens different things up in your low back than what you would have experienced just with the single plane of motion pelvic tilts where we were working only in that sagittal plane, the plane that cuts our body into right and left halves. So we're going to get about 10 pelvic tilts in here. Couple more here. And last one. Now we're going to rotate our legs to the other side, okay? And you can really feel this stretch like all in through here. So I really feel it, all the attachments along the base of my spine, across my pelvis here and back, okay? And now we're gonna tuck that pelvis under and then relaxing it back. You're tucking that pelvis, relaxing back. Great job, you guys. So we're really working those intrinsics of our core right now. This is different, tedious stuff than what you're used to doing. It's so good to help your body to keep its motion going. The spine segments can really lock up, and when that happens, the ones that are free are taking all of the stress of your movement of your back, and that can be really uncomfortable. Great job, and one more, 10. Okay, so now we're gonna go back into a quadruped position. Now we're gonna work on really activating our hips. So we're talking about our shoulders, we're gonna get activated where we're doing mat work. Shoulders are gonna be engaged some here too, but this is really gonna get our hips going here. Okay, so we're gonna start with our legs straight out behind us, okay? And then we're going to do a knee to elbow. So we're doing this almost inverted crunch here because we are facing the ground. So we're gonna do 15 of these. 4 and back, 5, and really pull the pelvis forward. 11 here, 12, 13, 14, and 15. Great job. Now we're going to keep that leg up in the air. We're going to go side to side. We're going to do abduction and adduction. Really try to stabilize the hip that you're standing on and have all the motion just be in the leg that's moving. Try to maintain the same plane throughout the motion back and forth here. So try not to let your foot dip. It's kind of difficult. And it's interesting to try to feel where you are in space too. I can feel my external rotators of the hip that I'm actually kneeling on right now firing even more than the one that's up for me personally. So if you're feeling that and the glute that you're having your body weight go through, that makes a lot of sense. Good. Now I want to do these rainbow diagonal taps, okay? So see how I'm kind of drawing a rainbow back and forth? I'm tapping across the other leg. It's a crossover tap and back. This is 5 and back, 6, back, 7, 8, great job guys, 9, 10, 11, 12, 13, 14, and 15. Now one more here. Keep going. We're doing hip extension with knee flexion. So we're going to get 15 just isolated hip extensions here. 6, 7, 8, 9, 10, 11, 12. Great job, guys. 13, 2 more, 14, and 15. Awesome. Woo! That got you going pretty good, especially on the hip that I'm on, honestly. Okay, so now leg is up, okay? We're bending forward. We're doing those knee to elbow tucks here. 3, going to 15, 4, good, 5, 6, 7, 8, 9. Glute activation is so important for spine health. When our glutes are not activating properly while we're walking, we end up having spine rotation that occurs for our bodies to move forward. So a lot of low back pain, especially as people age, actually stems from a lack of hip extension through their gait pattern. One more here, and 15. Great. All right, our legs up. Now we're doing that abduction, adduction, that side to side motion. Great. 5. Trying to maintain the same level. 6, 7. You can feel it in that upper body that you have postural control. Try not to move those hips. I saw my hips moving there. Really got to fight to keep nice controlled posture. And 15. Now that diagonal rainbow tap. 2, 3, 4, 5, 6, 7, 8, great, 9, here we go, 10, we're getting close, 11, 12, and we have one more motion, 13, 14, and 15. Now that knee flexion, hip extension, 2, 3, 4, 5, 6, 7, 8, this is where it burns, 9, hang with me, 10, 11, 12, 13, 14, and 15. Nice job. That was pretty tough stuff. And it's really just small intrinsic muscles. So we were firing our external rotators of our hips, we were firing up our hip extensors and our hip abductors and adductors. So getting all of that going, the lumbosacral pelvis combination is so important for us to have everything firing and doing its job when it's supposed to be doing its job. All right, so we're gonna next stand up and we're gonna do some anti-rotation exercises with the band coming out from the post over here. So I'm just gonna move this mat out of our way. And this is probably a good time if you guys wanna grab a quick drink and then we'll meet back here with some band work again. Okay, great. All right, great. So guys, if you have your band, now I want you to put it around either like a banister at your house or something similar, a pole. A lot of times the best thing is a banister is what's most common in people's homes. If you have a squat rack, I would put it around one of the arms of the squat rack. So what we're gonna do is we're gonna get into a lunge split stance position. So I'm gonna change here into this lunge. And then actually we're gonna do contralateral arm work, which means the opposite arm from the leg that's forward, okay? So we're here in this position, and then we're gonna push forward, and we're gonna bring it back out. So we're doing 2, 3, this is really working the internal obliques of the leg that's back. It's also working the opposing side of the body's spine rotators. It's keeping us from being pulled back by the band. So this is this lunge with the contralateral arm press. (14) and 15. Now we're gonna switch arms, okay? Pressing forward. You can hear my shoulders popping a little bit. I did a lot of swimming this week. There we go. 4, 5, 6. Those shoulder blades in the right position. 7, 8. So down and back. 9. Try to resist the urge to shrug. 10. Resist the urge to rotate your spine. 11. Again, it's internal obliques on this side, and it's the spine rotators on your opposite side. And 15. So this is much, I mean, we are working our pecs here and our triceps, but it's really about the rotation that we're resisting in our spine. So now we're gonna do the inverse of that, and we're gonna do the rows. So now, I'm gonna again contralateral arm to the leg that's forward, okay? That right foot forward, so I'm using my left arm to pull back, and I'm gonna back up a little bit because your rows are always gonna be stronger than your press. 2, good, 3, 4, 5, 6, 7, 8. Now working the external obliques and the rotators. 13, 14, and 15. Good, and then we'll switch sides here. 1, 2. Again, it's the external obliques and the rotators of your low right side. Obviously, latissimus dorsi as well. Biceps are doing the workload of the arms, but as far as the core anti-rotation goes, one more here, and 15. Great, so then we're gonna repeat those out, okay? So again, right foot forward, left foot's back. I'm doing that contralateral arm motion. We're getting that chest work. If you're feeling any kind of discomfort in your chest, just drop your arms. It can be lower here. Your elbows don't have to be high. What we're really focusing on is the anti-rotation of our core. 14 and 15. And again, switch legs. 2, 3, great. 4, really lock in those abs. 5, 6, 7, 8, 9, 10. 5 more here. 11, 12, 13, 14, one more here, 15. Awesome, back to rows. Okay, so again, scoot back farther with your rows, the lunge, and we're pulling. 2, 3, we can go wide elbow this time. 5, 6, 7, resist that urge to rotate your trunk. 11, 12, 3 more here, 13, 14, great job guys, and 15. And again, the other side here. Abs are nice and tight, locked in. 2, and those external obliques, latissimus dorsi bicep. We're almost there here. Give me 5 more. 5, 4, 3, 2, and 1. Great job, you guys. Sorry for my back to be turned, trying to kind of decide, but giving you that postural visual from behind I think can help a lot too, so you can see how the shoulders should be working. So one of our last things that we're going to do, this is a little bit more of an advanced exercise. We're going to get you down again in a quadruped position to start with. So I'm going to actually just kind of move back in here. We're getting into all fours. I'm on the toes of my shoes, okay? Now I'm going to thread the needle with my lower body. So this rotation here and then coming up. Notice I'm not lifting one of my arms off the ground. You'll see people doing this exercise where they open up here, but that's not really forcing you through as much of a rotation range of motion here. And I really want you to keep both hands touching the ground. Your body weight is going to shift to the outside arm as you rotate away, but I still, for range of motion purposes, really want you to keep both down. And these are a lot harder. This is one of the hardest things that we've done today. Give me a couple more here. Great. And rest. Okay. So we'll just take a little bit of a break there. But actually, stand up in between here. I want you to get down into a wide, almost like a sumo squat. If you're a ballerina, I want you to think about it as a really wide second position. We're going to get down really low here. I actually want you to tuck your pelvis under for this one. Arms are out to the side, and we're reaching. 2. We're going to 20 on these. 3, 4. So lateral flexion while we're doing posterior tilt on our pelvis. Everything's tucked under. We're really working those quads. 10, so we're halfway on these. Get lower. 11, I was drifting up. We want to be nice and low. There you go. 14, 6 more. 15, 16, 17, 18, last 2, 19, and 20. Awesome. And come up. Now we're going to get back down into that quadruped position, doing that lower body thread the needle rotation exercise. All right, so again, on both hands on your toes, rotating right as 1, 2, 3, 4, 5, 6, 7, 8, 9. Here we go. 10, we're going to fight for 10 more. 11, we can do it. 12, 13, 14, 15, 16, 17, 18, 19, one more here, and 20. Nice job. And like I said again, those are definitely the most athletic and the toughest exercise out of these different spine exercises that I'm taking you through today. But notice I did them at the end of the workout when we have already really primed the spine, we've warmed it up, we've gotten things going, activating the small intrinsics so that this could come together in a good cohesive result. So now again, getting down into that wide position, standing tall, my rib cage, I'm pulling it down. I don't want to flare my rib cage, but I want to pull it down. My pelvis is tucked under me, getting into that deep squat, arms out to the side, and we're reaching. 2, going to 20 again, 3, trying to stay nice and low, 4, 5, 6, 7, 8, my respiration rate's definitely up now here at the end, 9, 10, 11, 12, we're almost there, 8 more, 13, 14, 15, getting more range of motion as we go through, 15, this feels great, 16, really reach, 17, keep that pelvis down, 19, one more, and 20. Great job, you guys. That was the most difficult part of this workout. All right, now that we've gotten you through all of those, I want to take us down just a small light cool down, and then that's going to set you on your way for a great core activation spine health exercise. So here we go, down, feet shoulder width or wider than shoulder width apart. We're going to swan dive down, taking your right hand on the floor, opening the other one up. We're going to reach up towards the spine. You can feel the rotators here opening up. And then switch, opening up to the other side. Head down to the middle. Now walk your hands over here to your right foot. And if you really walked over here, then you can feel the attachments here on the left-hand side of your low back if you're at your right leg. And we can walk over to the left side. Now feeling the low back on your right side open up. Now I want us to squat down. We're going to go towards the floor here. I'm going to have us sit all the way back. We're going to do a quad stretch, and then we're going to do like a little bit of a variation with it, okay? So one thing that I like to do is I like to work the range of motion for internal rotation of the hips. So I am internally rotating this hip here, okay? And what that does is it opens things up in my sacrum, which is my tailbone area in back, and where my rotators attach right above that, I can really feel that opening up. I also feel the sartorius getting stretched out, and through here into my IT band and the tensor fascia lata on the outside. So opening back forward to the other side. So we're just kind of taking ourselves back and forth through the range of motion, but really feeling what that does across here in your low back, just as much as the leg that's getting stretched in the front, and keeping those hip sockets to be opened. Good, one more each side here. Excellent. Okay, so now I want you to sit up tall in this butterfly position here, okay? So we're kind of pushing down, we're doing a little opposite. Now we're gonna roll our backs. So really gently, opening up with some just calm, relaxed spine flexion forward. Breathing in nice and deep, and then exhale a little deeper into the stretch. One more breath in here, and exhale. Now pushing your feet forward. All right, we're gonna breathe in, and exhale out. Breathing in one more time, and exhale a little deeper into that hamstring and low back stretch. Last breath. And exhale, getting deeper into the stretch. Walk your feet up, always do everything gently. Now while we're here in this position, let's cross our foot over and we're gonna do a nice spine rotation, a seated spine rotation stretch. So here we go, looking over that shoulder, spine nice and tall. And back the other direction here, crossing over, again, spine nice and tall. And relax. All right, guys, thanks for joining me today in our core activation workout for spine health. I think it's really important that you incorporate a lot of these things into your routines, like once a week would be great. Taking care of your back, it just leads to a lifetime of health and wellness, so I really encourage it. If you guys haven't already, please subscribe to Synergistic Effects. It would help me out so much as I build my fan base and my the followers that are engaging regularly. I'm able to provide more and more of this content to you guys. It's my gift to you from 20 years of being an athletic trainer, and so I wanted to share with you guys a little bit of the sports medicine side of things that I do. So I hope this finds you guys all well, and take care. Bye, guys.